exploring opportunities through the ACA. And before I begin, I would like to share just a bit more about our organization so you have a feel for who we are and our view as it relates to weatherization plus health, energy efficiency, and health homes. So NASCAS is the National Association for State Administrators of the Community Services Block Grant and the Weatherization Assistance Program. And in the next slide, you'll see a listing of some of the activities that we undertake as an association. We do try to act as the voice for state interests regarding CSVG and WAC legislative issues. And we do customize on-site training as it relates to energy efficiency, particularly around the Weatherization Assistance Program. And as we begin to talk a bit more about the Weatherization Plus Health Initiative that we undertook, we can provide on-site and customized assistance there as well. On the next slide, I'd just like to point out that we also provide a forum for federal policymakers and industry experts about programmatic rules, guidance, legislation to advance the networks, create greater transparency, accountability, and impact. And so we're going to go ahead and move forward now and begin to talk about weatherization plus health. And just as a general overview, NASCAS began administering weatherization plus health a few years ago. And this was an initiative funded by the U.S. Department of Energy, really working to enable comprehensive and strategic coordination of resources related to energy efficiency, health, and safety for our target population, which of course is low-income individuals and families. And the impact of that work to date has been enhanced collaboration among public agencies and private organizations, particularly within the Community Action Network, yielding safer and more energy efficient homes, lowering energy costs, and creating healthy families. And so moving forward, I wanted to provide a bit of background or set the foundation as to how this initiative started. It just makes sense is the first piece to that. Health and safety is a key part of the Weatherization Assistance Program's mission, and you'll see that noted on the slide here, ending with ensuring their health and safety, ensuring the health and safety of low-income families, particularly the elderly, those with disabilities, and children. So it was a natural fit. And as we move forward, you'll note that, of course, weatherization, the Weatherization Assistance Program already contains a health and safety component. And so we have listed here some of those methods. Of course, WAP uses a do no harm philosophy, when implementing its health and safety protocols to mitigate the impact of weatherization's work. All health and safety measures are performed in support of installing energy conservation measures. However, WAP does not address hazards that are related to or caused by weatherization work. So lead-safe weatherization does not remove lead paint, but it does protect the area where work is being done. Asbestos and other environmental pollutants are protected or stabilized, but not remediated. And if the energy audit indicates that health and safety, the health and safety of a client cannot be maintained at pre-weatherization conditions, the home is deferred. And so that's really one of the key reasons for the Weatherization Plus Health project, is to create a broader reach, improving or advancing the impact of WAP and healthy homes by connecting these two groups, energy efficiency providers and healthy homes providers. So what Weatherization Plus Health is once again a DOE initiative to stimulate a new focus on comprehensive approaches to coordinate services for energy, health, and safety. What it is not, and I think Meg alluded to this, and we're actually on slide 9. So what it is not is a new funding source for agencies or communities, and it's not a strategy to replace Recovery Act funding. But what it can become is a true opportunity for reducing the referrals, creating better coordination between healthy homes and energy efficiency providers to increase the health of low-income individuals, families, and communities. And then on slide 10, you'll see just in terms of, weatherization providers go into so many homes per year, and then you look at the facts here in terms of health and housing. And we see that 6 million homes in the U.S. have significant health and safety problems. 90% of Americans' time is spent indoors, so in the home. And then we have $77 billion in terms of what's spent on preventable health problems. And so, once again, this kind of set the stage in terms of why it made sense to begin to increase or highlight or promote the connecting of energy efficiency and healthy homes providers. And some of you may be familiar with this report, Advancing Healthy Housing, a Strategy for Action, which came out in 2013. And on the next slide, you'll see the 5 goals from this report. And it was really an interagency effort pushed by or published by the Federal Healthy Homes Work Group. And so, once again, the Healthy Homes Initiative is not just a product of DOE, but this is really an effort at the federal level across departments and agencies, recognizing the impact of health and the home in place. So what the Weatherization Plus Health Initiative at NASCASP has done, one key product that we've developed to respond to this greater call for action related to healthy homes and energy efficiency, or the integrating of those two, is the creation of the Weatherization Plus Health website. There are a number of tools on this website, and if we move forward just one slide, you'll see the homepage of the website, and you'll note there are training materials located on this website. We, as a part of the push out or rollout of this effort, did a number of statewide and regional conferences providing basic information related to healthy homes, related to the Weatherization Assistance Program. So for those who are interested in getting started, there's information in great detail there around both of those pieces and around creating the connection, how you can facilitate a bringing of those two groups together within your state or community. In terms of resources, a number of toolkits and guides located there. There's a Finder Provider tool that we'll highlight and a Geo Explorer tool that we'll highlight. And then media, we do keep track of successes that are happening as it relates to Weatherization Plus Health efforts. And as we move forward, let's dig a little deeper into the Finder Provider tool. And it's really meant to be used by Weatherization Assistance Program or Healthy Homes providers while on site or at the desk when they understand that connections need to be made to prevent deferrals or of weatherization work in the home. And so if you move forward, you'll see the type of information that you can get related to connecting folks to not just weatherization assistance providers, but community action agencies, weatherization state contacts, folks who deal with lead, asthma, health and housing, healthy homes training providers. We have a great deal of information located here. So this is an excellent resource for folks who are looking to decrease referrals and increase the connection between energy efficiency and health in their network. On the next slide, you'll see we're going to highlight the Geo Explorer data tool featured on the website. And this is just an awesome tool for planning purposes and once again for understanding the resources that are available as it relates to connecting energy efficiency and health. And as we move forward, you'll see several of the overlays that are included in this Geo Explorer mapping tool. So we have point overlays, there are political boundaries that are listed there, area overlays as it relates to radon zones, climate zones, state boundaries. Census data is included and updated as regularly as possible, related to median household income, housing type, and housing age. Just a wealth of information, and for those who have not checked out the Weatherization Plus Health website, I'd encourage you to do so. And so now we're going to go ahead and speak to an example of Weatherization Plus Health in action, how it works on the ground, in the field. And for this, we've chosen to highlight Connecticut. We've taken a journey with them as they have really hit the ground running in terms of connecting energy efficiency and health in their state. So NASCAS hosted a regional event in Connecticut, including Connecticut, as well as state meetings. And we facilitated some discussion between CAFCA, which is the Association for Community Action Agencies, or private nonprofit providers there, and New Opportunities, Inc., a local agency. And as a result of that, we provided some information around funding opportunities. New Opportunities decided to apply for a grant from the Connecticut Department of Social Services to fund injury prevention and asthma trigger reduction in 50 homes. And this was really to be performed by Weatherization Assistance Program providers. And so, in this tight funding environment, this is an opportunity also to supplement energy efficiency funding by coordinating energy efficiency and health. So this is the approach that they took. And then New Opportunities and the association CAFCA contacted NASCAS to provide TNTA, or technical assistance, also in commissioning a rapid health impact assessment. And the HIA, or Health Impact Assessment, was really about measuring the impact of energy and non-energy related health and safety benefits of measures to be included in the state Weatherization Assistance Program Health and Safety Plan, as well as a utility-run weatherization program in Connecticut. And moving forward, you'll see that the HIA was released in April of 2013, and as a result of the work there, NASCAS, New Opportunities, and the association, CAFCA, provided testimony on the health impact assessment to the state's Energy Efficiency Board to really begin to influence policy and decision making as it related to energy efficiency and health measures for low-income individuals and families. So Connecticut is really a good example of the opportunity for WAP providers in healthy homes, recognizing that they were already in the home with WAP funding cut down. They took advantage of the opportunity to do remediation work in 50 homes because they knew that they were eminently qualified to do so, and it would lead to additional opportunities. And so since that time, they've been engaging stakeholders for referral opportunities that include lead hazard control and utility-run weatherization dollars to supplement WAP dollars as needed. Did want to share a bit more about health impact assessments. And this is, if we can go back just one slide, this is really an area that's growing. And we would encourage WAP and Healthy Homes providers to pay close attention to opportunities as it relates to conducting health impact assessments. So you can see here that they're on the rise and in which areas they're increasing. But this is another opportunity to engage with non-traditional program providers and partners to increase funding, but more importantly, increase the impact you're making for low-income individuals and families. And a bit more on the next slide around Connecticut's rapid health impact assessment in terms of why they chose to pursue that path and why that made sense to them. They have an energy efficiency goal to weatherize 80% of their housing stock by 2030. Commendable and ambitious. There were two decisions kind of at stake, and we talked about the WAP state plan, but also there was a state public service commission, and they were looking to understand what health and safety measures they should be including in utility weatherization programs. And so we also have listed here some of the partners that were involved in this effort, so folks can get a feel for, in their communities or states, folks that they might be able to reach out to. And there's also a report, and so we would hope that you would feel free to check that out to gain information on their efforts. The next slide is really a bit more information on their health impact assessment. A key part of the HIA really involves developing a scoping pathway or a shared understanding based on evidence and norms of practice for public health of how decisions under consideration are likely to affect health. So this is the pathway developed by Connecticut, and it shows that energy efficiency has health benefits, as does the core package of weatherization assistance program measures, including, things like heater tune-up and repair and combustion safety. And so it also shows that added health and safety gets you more health benefits and a range of outcomes. So there are 4 pathways indicated here, indicating how weatherization influences health, and the first is through housing affordability. The second is related to housing adequacy or quality. The third is related to outdoor air pollution. Of course, it varies there depending on how much demand and peak demand for energy is reduced by energy efficiency. And then the final is, or the fourth, local and state economy, varies once again depending on jobs and new spending generated by energy efficiency and additional health and safety interventions. Sure. Okay. And so, we have some additional information here. If we move to the next slide, about Connecticut. But what I would encourage you to do, if you're interested in moving forward with a Weatherization Plus Health initiative or expanding that initiative, is to visit the Weatherization Plus Health website, where we have a number of models, tools, and resources located. Additionally, feel free to contact NASCAS for one-on-one assistance in how to move forward. And I don't know if we want to pause and switch, or if we want to move forward with the ACA information. Okay, great. So we're going to talk a bit now about the Affordable Care Act and where healthy homes providers and energy efficiency providers fit in, or where some opportunities might be for them. And I'm going to, just in the interest of time, I'm going to try to just hit the highlights here. So if we move forward to the next slide, you'll see just an overview of what the Affordable Care Act is really all about. It's insurance reform to get more people covered, more benefits and protections, lower costs to consumers and to government, and then it's also about health system reform. So improved quality and efficiency, a stronger workforce and infrastructure, a greater focus on public health and prevention. Moving forward is just a map in terms of insurance reform under the ACA and the state health insurance marketplace decisions. You can see those folks who are pursuing state-based marketplaces, federally facilitated marketplaces, and then partnership marketplaces. Moving forward, we have another piece here on Medicaid reimbursement. Expansion of Medicaid and Medicare is really key in terms of where folks might be able to find some opportunities to gain additional funding. It's through the expansion of those programs. And so here we have an example of what states are doing around Medicaid reimbursement of healthy home services. And do want to highlight that in Vermont, they're connecting ACA to asthma and lead related to healthy homes issues. In terms of, on the next slide, expansion as it relates to the ACA and Medicaid and Medicare, really need to pay close attention to what's happening in your state. And we have some information here related to what states are doing around expansion. On the next slide as well, some additional information around where expansion is happening. And in the green, dark green, you'll see where states are expanding coverage, light green, considering some expansion, and then in the gray, not expanding coverage at this time. So it's important to understand the context in which you'll be working as it relates to ACA opportunities. On the next slide, we have a couple of resources. So these are key websites for information on ACA, so you can understand what's happening in your state, in your communities, so that you can pursue opportunities related to healthy homes or health impact with housing opportunities under the ACA. So this is a state reform website, and you see the homepage and address there. The next one is the Commonwealth Fund, and that's a private foundation that aims to promote high-performing healthcare systems. And the fund carries out that mandate by supporting independent research on healthcare issues and making grants to improve healthcare practice and policy. So that's a key website and resource there. The next one, want to highlight a guide that's available, the community guide, to preventative services, a free resource to help you choose programs and policies to improve health and prevent disease in your community. Another key resource when you're looking to develop initiatives that might be funded and understanding the context in which we're working. Moving forward, insurance reform under ACA, more benefits and more protections, some information there around the essential health benefit and some guidance, but really the next step is about contacting your state agencies, whether it be Medicaid, around health reform, to learn whether essential health benefits include housing-related measures. On the next slide, you'll see in blue, these are some things that the Weatherization Assistance Program providers, healthy homes providers, and community action agencies more generally can do to get in on some of the requirements, or assisting in the requirements and getting funding to do it for fulfillment of ACA. Okay, and so as we move forward, we have a number of additional resources. We have a model to watch on slide 36, and that's Multnomah County in Oregon. And there's a kind of just an example there of what they're doing to give you some ideas and guidance. On slide 38, some additional information about what's being done and how you might fit. I do want to highlight on that next slide a number of other resources for folks who are interested in asthma specifically, and some opportunities that are available there related to Medicaid. Let's see. The next slide, we have some delivery and payment models, but there's a wealth of information listed here, and I think on the last couple of slides, we have some potential activities. If you go to slide 48, to just get you started, if you want to start the discussion in your local agency, within your community, within your state, around taking advantage of some of the ACA opportunities and helping folks, whether it be hospitals or others, fulfill the requirements that are coming down as a result of ACA. So once again, NASCASP is here to be a resource. We hope that you'll download the PowerPoint. If you have any questions or concerns, feel free to contact us and we'd be glad to engage.